puberty blockers were an experimental treatment for which there was no evidence, and Cass has confirmed this over and over again, the lack of evidence. And given that our first duty to patients, and perhaps particularly to children, is to first do no harm, it's quite extraordinary how clinical services were penetrated by an ideology that seemed to enable them, or they gave into, or they participated in, the complete putting aside of the ordinary canons of clinical care. The Cass review is the most thorough, most wide, and most extensive review of treatment for gender distress in children ever undertaken anywhere in the world. Findings confirm the concerns that we had, that it's inappropriate to intervene medically in children who express distress in relation to gender. It's inappropriate for many reasons. But the headline is that puberty blockers were an experimental treatment for which there was no evidence. And Cass has confirmed this over and over again, the lack of evidence. Let's do a thought experiment. Take a population of 100 children who all express gender distress. The first thing that Cass says in her review, which we've been trying to say, is it's not a unitary condition. It's a very complex condition of multiple causations, which I'll mention in a moment. But if we just take those 100 kids, there's quite reasonable evidence that if those children are managed in a better way, that is, they're not put on a pathway with medical intervention, but supported to explore why they feel the way they do, what its history is, the narrative of their lives. And that takes sensitivity, care, and quite a long time. The majority will desist. They'll change their minds. But there is no way of knowing which child would change their mind and which child wouldn't. No way at all. So if we say out of that 100, say 5 would go on to transition when they're 25 or whatever, that wouldn't be a reason for damaging the other 95 children. But even so, those who go on to transition later in life will benefit from not having done it suddenly, not having done it during a time of adolescent turmoil and confusion, having done it in a thoughtful way within a position to understand the nature of what they're doing, its long-term consequences. And so they'll do it on a much better basis. I worked at the Tavistock for 25 years in the adult department, and I'm very, very proud of my work there and having worked for an organization which I still have very, very considerable respect for. But something went wrong. The management at the time were not clinicians, and they seemed to get captured by the trans ideology. The gender service was run by Polly Carmichael, as you probably know, and Polly Carmichael had no psychotherapeutic training and was quite mocking of psychotherapy and psychoanalysis, which were the sort of part of the mission statement of what the Tavistock stands for. That is, an in-depth understanding of the complex nature of psychological problems and situating them within an individual's narrative and their sociocultural location and so on. This service was putting children on puberty blockers after sometimes only 1 or 2 meetings, without at all going into the complexities of their lives. And I heard from the clinicians who were working there, those are the ones who came to talk to me, that when they talked about more complex issues in these children, issues which they not be so fully aware of, things that are not quite conscious, they were mocked and laughed at. So how it could be that such a service managed to occupy such an important place in the Tavistock is a big question. I know the CEO at the time used to regard the GIDS as the star in our crown. It was something that many of us at the Portman Clinic and the adult services and quite a lot of quiet people in the child and family service did not agree with. But people didn't feel able to say so. They were intimidated.